any time you're watching this and you're like, wait a minute, I missed what he just said, you can always go back and watch the replay. And all of the episodes that we've done are available on YouTube. You can find so many really, really good topics that we've
My
talked about. And
amazing.
there we go. And this is episode 267 just on, Wednesdays. So we've talked about a few things. Primarily on Wednesdays, we had talked about type 2 diabetes, but we now are expanding that to be type 2 diabetes and heart health. Likely those will rotate. Today, we're going to talk a little bit about heart. And I just want to let you know that tomorrow is usually when we do our Healthy Heart webinars, but we have changed that as well to our Home Cures That Work webinar. And that is kind of based off of a publication that Dr. Saunders helped to write, where we talk about other health, many, many aspects of health, from what's a good kind of water to drink to mental health to just so many different things. So really, really good topics, same type of format. If you're already registered for both of the webinars, if you registered for both of these a year ago, guess what? You're automatically in. If you haven't registered for Wednesday or Thursday, go to bartonwebinar.com. You can register for those there. Okay. And if you're here, you're already registered for Wednesday if you're watching this on Zoom. So no need to do that. YouTubers, feel free to go to bartonwebinar.com. And I'll just mention here quick, use code webinar25 to save 25% on anything that you may find there. It feels funny for me to be on this live. I'm going to be honest, because we just had election last night and this morning and I just was watching a lot of coverage. And so now I feel like that's what we're doing. I'm looking at myself and we're talking, and I feel like we're supposed to talk about election results, but we're not going to. We're going to talk about keeping ourselves healthy.
Yeah, because
So,
somebody cheated. We're not going to talk about that.
all right, here we go. So, let's see. I want to get this exact topic title correct. I think I have it right in YouTube, but we're going to talk about the most common symptoms of a heart attack. Okay. So this is going to be interesting. If you have any thoughts about this or questions as we go, feel free to comment in the Q&A. That is the best place for me to manage questions, and I'll find them a little bit easier than if you put them in the chat. So symptoms of a heart attack, I have kind of a list here, and so I just want to ask you about them, Dr. Saunders. So these are posted in various places, but this is one of the top symptoms of a heart attack is severe pressure, fullness, squeezing, pain, or discomfort in the center of the chest that lasts for more than a few minutes. Is that true?
Okay, this is really interesting because a heart attack, here's the problem. The heart does not have any pain nerves, none. So how can the heart attack have any pain at all? Well, because of the damage being done to the heart, there's like pressure that builds up, and so you can feel it, but it's indistinct. You can't point to it. If you can point to it and say it hurts right here, then you know it's not a heart attack, right? That's not an issue. So that pressure sense where people go, it hurts like here or yesterday. Yes, this is just yesterday. I had a woman in my office, and she said, yeah, I get this pain. Like I walk up the stairs and I get this like pressure right here, like I can't breathe, like I can't take a full breath, and it's like pushing on me right here. And so some people they'll clench their fist and they go, it's like this. Other people will say it's like an elephant sitting on my chest. That's a bad heart attack, when elephant's sitting on your chest, right? That's like, it hurts. But it's not like I can point to it. It's not like that kind of pain. And it's not like it hurts when I move. It's just really painful and a lot of pressure. So, for example, pressure pain is like, well, if I step on your toe, that's pressure pain, right? if you have your finger in the door and close the door, then that's pressure pain, right? And that's very painful. In fact, spasms of muscles are like the worst pain people have. If you think of like kidney stones or having a baby, that's all pressure pain. And so people feel that in their chest when their heart isn't getting enough oxygen. So yeah, squeezing, discomfort, and indistinct, that's the kind of thing. And then it lasts for more than a few minutes, like you said.
All right. So another kind of note on this too, it says that pain or discomfort that spreads to the shoulders, neck, arms, or jaw.
Yeah, see, like I said, the heart doesn't have pain nerves, so you can't point to it and go, that's where it hurts. So that pain, that pressure, you feel is like, yeah, I feel this pressure up in my jaw or my shoulder hurts. A lot of people have gone into the doctor with shoulder pain and found out they were having a heart attack. That's a real thing. So yeah, it's referred pain.
Okay. Uh, and then, so typically, if you have pain and then it goes away and then comes back and then goes away, is that typical? Or would you say that it just consistently, if it's continuing to get worse, that's likely a heart attack?
If it's getting worse, then you're probably having a heart attack. If it's coming and going, then you may have angina. It still could be heart pain, but it's probably not a heart attack.
Okay, interesting. Okay, so this is another common symptom of a heart attack. It says chest pain that doesn't get better with rest or by taking nitroglycerin.
So think about this. If you're exercising your heart and it's not getting enough oxygen, if you're not getting enough blood flow, then as you exercise, your heart has to pump harder, but it can't because it doesn't have enough energy. So it's going to hurt more. And then you rest, you relax, and it goes away. Okay, so that's an indication that it may be a heart problem. Now, where does the nitroglycerin come in? Well, nitroglycerin is a nitric oxide. It makes nitric oxide, so it dilates the blood vessels and allows blood to go through. So most of heart attack is a constriction of blood vessels. And so you put nitroglycerin and it dilates, and then the blood flows to the heart again and the pain goes away. So the expectation is that if you take nitroglycerin, the pain should go away.
Okay, interesting. All right, see another one here. All right, so then it said symptoms of a heart attack is chest pain that happens along with any of these symptoms. So if you have chest pain plus sweating, cool, clammy skin, or paleness.
Yeah, so if you're not getting circulation, then you get pale, sweaty, clammy. You start sweating, and it's cold sweats. That's the autonomic nervous system reacting to the brain not getting enough blood flow because it's a lack of blood flow. That's what the pallor is too. You turn pale. So that's a bad sign. That means number one, you're probably having a heart attack. Number two, you're not getting enough circulation. So that's a bad sign.
Okay. Chest pain with shortness of breath.
Okay, that's it. That's a really interesting one because there's two reasons for shortness of breath. One is that the lungs aren't working right, and you just can't get enough air into your lungs because your lungs aren't exchanging very well. Like, let's say you have fluid built up in your lungs or something, or a collapsed lung, and you're getting short of breath. Well, that's because the lung isn't working right. There's another reason for shortness of breath, and that is the lack of circulation. So if you're not getting circulation to your body, you're not getting enough oxygen to tissues, especially your brain, then your brain is saying, hey, I need more. And you feel this sense of shortness of breath, even though it's not your lungs, it's actually the heart. And that's one of the things that we have to deal with when, a doctor has to deal with when somebody comes in and says, I have shorter breath. First thing you have to know, is this a lung problem or is this a heart problem? That's important.
All right. Chest pain as well as nausea or vomiting.
Yeah, if you feel that like a chest pressure and you're getting nausea or vomiting, that's a common sign because that's the autonomic nervous system again. That's like the sweating, the cold sweats kind of thing. That's really important. That combination of chest pain with nausea or vomiting is a bad sign. It means a lack of circulation.
Okay. Chest pain with dizziness or fainting. Why does that happen?
Yeah, dizziness or fainting. So the same kind of thing. If you're not getting enough circulation, and you stand up suddenly and you can't get the blood up to your head, you turn white, you turn pale, and you're going to be really dizzy. You can't focus. Your vision closes in. All of those kinds of dizziness or fainting kinds of things. That's a lack of circulation to your brain, and that's really important.
Okay. How about chest pain and then unexplained weakness or fatigue? Kind of the same thing?
Kind of the same thing, a lack of circulation to the brain, and you feel weak and fatigued. It's like just not having enough oxygen, not having enough energy.
Okay. And then chest pain with rapid or irregular pulse.
Yeah, so if your heart is beating really hard and or it's really irregular, that could be like atrial fibrillation, and those are common signs that you have a heart problem, and it could be a heart attack.
All right. Um, so there are a lot of other option or a lot of other things, I guess, that could be similar to some of these symptoms. So how do you know when, okay, so for example, let's say, for example, you have pneumonia, or pleurisy or indigestion, and some of these are mimicking some of these things. Is it, do you get chest pain with those types of things, or how do you know, okay, this is the real deal, it's time to go in?
Yeah, you can get chest pain, and it's hard to distinguish sometimes. Pleurisy, you can often point to it because the pleural membranes have nerves in them, so you can say it hurts right here. Then I take a breath, and ow, it hurts. That kind of thing. So pleurisy might be a little different, but it can be kind of indistinct sometimes too if it's a general inflammation. The People often have spasms of the esophagus, and so the esophagus spasms, and they'll point to it, right in the middle, but you can't really distinguish that very well from that pressure-like chest pain that you're getting from a heart attack. So a lot of people, 300, or I'm sorry, 805,000 people a year have a heart attack in the United States. So 805,000, that's a lot. And 3 times that many have chest pain and go into the hospital and are not having a heart attack. They're having other things like a panic attack or spasm of the esophagus or pleurisy or chest pain for other reasons, spasms of the intercostal muscles and inflammation and intercostal chondritis and that kind of stuff. So it's not an easy thing to tell. So how do you tell? Well, you can do an EKG. That's really helpful because if you're having an acute heart attack, your EKG is going to show some changes that are characteristic of that. Something like pneumonia can show up with shortness of breath and chest pain. And if you have a pulse oximeter, one of those oxygen meters that you can put on and just watch your pulse, you'll see your pulse is regular and then the oxygen is low. If it's below 95, then you go, it's probably a lung problem. And either the lungs are filling up with fluid or there's pneumonia or an infection or something else like that going on. So there are, of course, ways to tell, but, a lot of times in the emergency department, they don't know. So they draw blood and they look for something called troponin, which is an enzyme that's released or a protein that's released from the heart when the heart cells are dying. So if you're having a heart attack, that troponin level is going to be really high, and they go, yes, you're having a heart attack. And,
Interesting. Okay, and again, let's talk about this a little bit more. Tell us what is exactly happening during a heart attack.
Okay, that's kind of important to know. So what's happening is there's a clot in the artery that feeds the heart. And how the clot gets there is dependent on a lot of things. You could have atherosclerosis. You could have a problem with your arteries, arterial disease, inflammation in those arteries, and that can form a clot. Or you can have a clot that's somewhere else and goes into the artery of the heart and plugs it up. But a clot forms, and that clot forming in the artery blocks it off and prevents the blood from flowing through it.
Are
So
these accurate or not?
yeah, that's actually
These
pretty
are.
good.
Okay.
Yeah,
Okay.
yeah, thrombus. That's pretty good.
Okay.
That's what a thrombosis is. Thrombosis is the act of making a clot, and thrombus is the clot itself. That's what's happening in the heart. You're making clots. So it's really important to know if you have a clotting problem. So I do tests on people all the time. And in fact, if you look on the tests that we have in the Healthy Heart Solution Kit, a lot of those tests have to do with clots, whether it's inflammatory mediators. Some of the inflammatory markers indicate clotting. Fibrinogen indicates clotting. D-dimer is a test to see if you're breaking down clots. And so you've got high D-dimer means you're breaking down a lot of clots. There's a lot of clotting going on. And so, yeah, and the other things are things that damage the arteries. So things that damage the lining of the arteries, a lot of inflammation, for example, causes that lining of the arteries to get damaged, which can then allow clots to form on the arteries.
So you start having these chest pains and say you're nauseous, you have a lot of these symptoms. How much time do you really have before you're in trouble without treatment?
That depends. So you can have a clot that is covering like 3/4 of your artery, and if you exercise, you'll notice it. But if you're not exercising, if you at rest, you won't even notice it. All the way to a completely blocked off artery, which has to be taken care of like right away, like now. So there are things that are really urgent. You know, when they say I'm serious as a heart attack, they mean that when it's completely blocked off, and you're not getting any blood flow to that area of the heart. So those heart cells are going to die if they don't get some blood flow quickly.
Wow. Okay. Okay, I did see another question. Okay, Christine had said, can you have a heart attack but it not be fatal?
Oh yeah, absolutely. In fact, most heart attacks by far are non-fatal heart attacks, where you get blocking of the artery and actually a part of the heart dies. The cells die in that area and it forms scar tissue, and you can continue on with the rest of your heart and still live. So it's not always completely deadly. In fact, most of them aren't. Interesting. So we talk about like hypertension, high blood pressure. In the studies on hypertension, if you decrease your blood pressure, if you're taking a blood pressure medication to lower the blood pressure to normal, for a long enough period of time, like decades, like 20 years or something like that, you lower your risk of having non-fatal heart attacks, but it doesn't really change fatal heart attacks at all. And that's the weird thing about everything in medicine. It's like, dang, people still die. Even when we try everything we can to save them, people still die. So uh, though preventing the non-fatal heart attacks is what prevents you from being a cardiac cripple. You're disabled because you can't walk because you don't have enough heart muscle to pump the blood enough to even just get around the town, get around your house. so I think mostly it's most important to prevent disability, because I guess, somehow everyone dies eventually.
Okay. Let me go back up to some of these comments. Again, if you can post those in the Q&A, it's just a little easier to manage those there. Okay. Hello from Terry and Eve in New Brunswick. They're visiting in Alberta, but what does Dr. Saunders think about taking zeolite colloidal suspension for removal of heavy metals in the body?
Okay, that's interesting. So I've known a lot of people that have used zeolite, the colloidal suspension, and it's essentially it's a kind of like if you've ever had a pool filter that has DE, diatomaceous earth, it's like dust, and it does hold on to organic toxins, but I don't know that it holds on to heavy metals, so I don't think it's a good heavy metal chelator. Um, and that was from my studies done a long time ago, like 10 years ago when I looked it up. I was like, oh, and so I decided not to use it, and I was using other things instead, like um, cilantro. Cilantro is actually a pretty good heavy metal chelator. And let's see, chlorella. Chlorella is another one that holds on to heavy metals. So I don't know. I don't know if zeolite. Zeolite's good for organic stuff, organic toxins. Like I think it's used for glyphosate, which is Roundup, and I'm not sure what else it would be used for.
Okay. I think this is what we're talking about here, but I was just going to share this. This isn't our product, but I have heard of it as well. So
Yeah.
it says it detoxes heavy metals, but I don't know. Gut and body detox. Okay, good to know. All right, let's do the next question here. Sandra says, is there a way to get the blood sugar lower for the first morning reading?
Blood sugar morning? Yes, there is. Do phase 1 of the program. So phase 1, if you go into the diabetes solution kit and you start on phase 1, and then if it doesn't seem to be working, and if your morning reading is still getting high, start doing testing your ketones in your urine. So just go to any pharmacy and buy the urine dipsticks, the keto sticks they're called, and then pee on them in the morning. And if they're not turning purple, then you need to cut back on carbs, and just keep cutting back on carbs until they get purple. So when they're purple, what you'll find is that morning blood sugar will smooth out really nicely.
All right. Christine says, great questions. I have feelings of extreme constriction, like a belt is around me. I always wait for it to go away. I assume stress, but it can last for many minutes.
Okay. All right. You know what? That could be your heart, and it could be the other reason for having a heart attack, and that is constriction of blood vessels from stress. And so yesterday I told you I had a woman in that was complaining of chest pain, and I'm pretty sure it was her heart. In Japan, they call it Takotsubo syndrome. In United States, we call it Prinzmetal's angina. So this is a special kind of angina that is when the blood vessel, instead of getting like a clot that blocks it off, it just closes down, it squeezes down and doesn't let the blood flow through. And it can cause chest pain, same thing, and it can last for minutes or even hours. And it's due to stress. And so that's what this woman had. Her husband died, and then her ex-husband died, and she and her ex-husband were still friends, and she's managing his estate, and it was a big hassle. And so she's going through a lot of stressful stuff in the last 3 months. And since her ex-husband died and she's dealing with his estate, she's been getting this chest pain. And so I just sent her for tests, but there is such a thing as a broken heart. That's what Takotsubo syndrome is chest pain is like having a heart attack due to a broken heart, being brokenhearted, and that's an emotional thing, and that's a stress thing. So the thing that I told her is don't diminish it just because it's stress and wave it off. Oh, it's just stress. No, it actually is bad for your heart. It is not good. That you are more likely to have a heart attack or die from this. Your risks are higher than if you had hypertension, high blood pressure, or high cholesterol, or any of the things that they tell you are really bad. This is a bigger risk factor than that. So it's really important to take care of it. And we talk about that a lot in the Healthy Heart Solution Kit about reducing stress and why that's so important and how to do that.
Just a reminder that you can find any of the kits or the programs that we're talking about at bartonwebinar.com. Okay, Gary says, what causes stenosis of the aortic valve and how do you prevent it?
Oh gosh. Okay, stenosis of the aortic valve means the valve is normally about this big, and it's about an inch across, and what happens is it gets the leaflets of the valve stick together in it, and so you have less and less flow, or less and less area to flow the blood through. And if it constricts too much, the heart has to beat and push that blood out of a smaller space. So you can see the three leaflets there, and how they kind of stick together in the corners, and they come together, and now there's only a little bit of room for the blood to come out. And then, so how do you prevent it? By having low inflammation. So this is an inflammatory process, and there may be nothing you can do specifically except to lower inflammation, because some people have connective tissue problems like EDS, Ehlers-Danlos syndrome, that can affect how your heart valves function and how they're damaged over time. But the inflammation that causes them to stick together could be diminished. So one thing to do, and we talk about this in the Healthy Heart Solution Kit, is to make sure you have enough omega-3. Omega-3 oils are really important. And then so your balance ideally would be about 2 to 1, omega-6 to omega-3, about 2 to 1. Most people, I measure people all the time, and most people are around 10 to 1. I've had people 13 to 1. That means you have 13 times more omega-6 than omega-3. That's a big difference, and that's creating inflammation. Omega-6 creates inflammation. Omega-3 suppresses inflammation, and so you need this 2 to 1 ratio. And ideally, probably from our best research, even 1 to 1 would be an ideal level of omega-6 to omega-3. We just allow 6 to 1, or what, because all of our stuff comes from like corn, our omega oils, corn oil and safflower oil and sunflower, all our vegetable oils with polyunsaturated fatty acids, PUFAs, which are very important because they're essential fatty acids. But they all contain a bunch of omega-6, but they don't contain any omega-3. Whereas if you were eating flax and chia and fish, if you were eating a lot of fish, you could have the opposite. If you lived on fish, you could have the opposite, have higher omega-3 than omega-6. But they're all PUFAs, we need them.
All right. Allison says a 70-year-old friend woke up one morning and couldn't breathe, went to the hospital, and they said she has congestive heart failure. Put on oxygen for 3 weeks, went into the hospital, and they took out a liter of fluid out of each lung. Can now breathe better, but still on oxygen and doesn't feel any better. Gets no answers from the hospital. Any thoughts? She used to exercise and walk and lived an active life until all of a sudden she can't.
Yes. Okay, I do have a lot of thoughts on that. This is what you get from modern medicine. So remember that our medical system was formed in the early 1900s. And in the early 1900s, they didn't have any way of determining what a problem was, why somebody had. All they had was a symptom. You're peeing too much. Oh, diabetes. And they have no way of knowing what kind of diabetes is, what's the specific chemical that's high and what's low and what's normal. Well, the same thing with heart disease. So this system that was created back then is continuing today. So these doctors are working in the dark ages of medicine. They're essentially, you're getting 19th century medicine when you go to a hospital. Everybody thinks they're getting like modern medicine. Well, modern medicine, the word modern medicine means 19th century medicine. So that's over a century old. And so now the way this should be handled, because we actually have the ability to do this, is to look at why. So she's functioning normally and something happened, and now her heart is not functioning normally, filling up with fluid. So if all you do is suck some fluid out of the lungs, what's that going to do? Well, she'll breathe better temporarily until the lungs fill up with fluid again. And then what? I'll just give her a diuretic or something, make her dehydrated. That's still just dealing with the symptom. That's the 19th century medicine, is dealing with symptoms. If you want to come to 21st century medicine, you start testing. Okay, why did this happen? Did she get congestive heart failure because of a viral infection? Is she missing an enzyme? Is she missing a nutrient of some kind? Did she get toxic on something? Did she have a heart attack? Looking at all of the possibilities of why the heart could stop working, would allow us to say, oh, this happened because she had a heart attack. Okay, so if that's the case, then we need to repair that part of the heart so that the heart can function again, so that this doesn't happen again.
Okay, Lily says, what is angina?
Angina is the pain. That's the pressure-like pain. And it's a chest pain. And the reason it's called angina as opposed to pain, because it's an unusual kind of thing. It's a pressure-like, and it's referred pain. So it's not like specific to the heart. So it has its own name.
Okay, Andy said I was at Costco yesterday and got into a discussion with a couple on the most beneficial cooking oils. Out of the blue, the lady mentioned ghee, which is sold at Costco. As I'm trying to lower my LDL cholesterol and manage general heart health, I'm wondering whether ghee is a good product for cooking.
Ghee is a good product for cooking. Yeah, the best cooking oils are butter, ghee, and coconut oil. The reason is because they're almost all saturated fat, and saturated fat doesn't oxidize. So if you put polyunsaturated fatty acids, PUFAs, vegetable oils in a lot of heat, they oxidize, and those oxidized PUFAs cause inflammation in your body. So coconut oil is a better choice, and ghee is a good choice, and butter.
And the best would be, what's the kind of butter that we like? The what's it called?
The Irish.
Yeah, I was gonna say a lot of the stores are starting to have their own versions of it.
Grass-fed
Nice.
butter.
Yeah, they have like their Irish grass-fed butter. Of course, there's the brand name, but a lot of places have their own versions now, which is kind of nice. But we do cook with ghee actually as well. So Tom said, my brother died of a heart attack at 72. He had atrial fib off and on for a couple of years, but he died with no symptoms. He died in the middle of speaking a sentence. Is this common?
Well, not common, but of course, you think about a clot, right? The arteries flowing, blood flowing, blood stops flowing, and then all of a sudden it doesn't work. And when the heart doesn't work, then you're not getting any blood flow to the brain, and so it can just happen very suddenly. A couple of years ago, my dad died in that way. He was actually getting ready to go to the doctor. He got up, took a shower, sat down, was getting dressed, sat down, bent over to tie his shoes, and he just kept going and fell on the floor, and he was gone. And didn't say anything, didn't say, oh, my chest hurt, nothing, just bent over to tie his shoes and fell on the floor and was gone. So yeah, it happens that way, because if it's a clot, like a heart attack, clot forms, boom, plugs it up, done. For some people, not always. Most of the time, it's not plugged up like that and gone.
But also a reminder to know where you are in your faith is what I would say. Okay. Jan says, I'm in heart rehab. My heart rate is averaging 140 to 158. yet my blood pressure is anywhere from 102 over 60 to 130 over 80. I had a triple bypass. Why would the therapist seem worried? What is metoprolol for?
Okay. Metoprolol lowers your heart rate. The problem is that you have a dysfunctional heart. It's pump failure. Your pump is failing. And here's what's happening is the heart is beating, but it's not getting enough blood out. So it has to beat faster to get more blood out. But at the same time, the heart itself doesn't have enough energy to maintain all of it. So it can't keep your blood pressure up. And so then you take metoprolol. Metoprolol slows down the heart and allows it to fill better, fill up with blood so that you could get more out. But at the same time, that also drops your blood pressure. So that's a terrible position to be in. And cardiac rehab is the right place to be. And it's really important to build up that muscle, the heart muscle, and increase the energy that's available to it. And make sure you're getting coenzyme Q10, L-carnitine, D-ribose, and magnesium, because those are common deficiencies. And if you have enough of them, you can rebuild both the muscle itself and mitochondria. There's also something else you can do. It's fasting. As you fast, the mesentery, the fat cells, as they shrink down, they make stem cells. Better said, they activate stem cells. And those activated stem cells will go and repair your body. So all of the repair for your body happens while you're fasting. But in this case, you might want to do a more long-term fast so that you're using fat for energy and not just like, a 10-hour fast or 1-day fast. Some people do like 10-day fast or 20-day fast or 30-day fast. I had somebody who had severe heart disease, who couldn't walk across the room without getting crushing chest pain, who was told that if he didn't have a bypass surgery, he wasn't going to live 30 days. He decided he didn't want surgery, so he fasted with water only for 30 days. At the end of 30 days, he was playing a full tennis match with no chest pain. Never had any chest pain again in his life. Well, as far as I know. I don't know if he's probably still alive. I haven't seen him in a year or two. But anyway, so the repair happens of your heart muscle. It happens when you activate stem cells to do that repair. And that happens when you're fasting. So that would be, it's a little trick that I learned that hardly anybody knows. It's been known for 100 years, but everybody says, la, 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 la. I don't want to hear that because everybody wants to eat.
It's true.
I know, right? Me too. I'm one of those. I'm a foodie. I love food.
I know. Okay. Let's see. Sib says, so thrombosis is similar to an aneurysm?
No, opposite. So thrombosis is a clot that plugs up the artery. So it's a clot inside the artery that plugs up the artery. An aneurysm is the artery that has a balloon on it. It's like enlarged and thin-walled and ballooning out because it's weak. So it's a weak wall of the artery that's ballooned out. And it can form a thrombosis in it. And that often does happen and prevents like stroke or damage or stuff like that.
Okay. So Anonymous said, if you have an aneurysm, is it possible to shrink it?
Probably not. Most of them need to be either surgically repaired, removed, or they do now, they clot them off. If there's a clear aneurysm, they can go and they can put like a wire in it. It's like a little coil wire that coils up inside there, that causes a clot to form in there so that it's all clotted off and it won't burst.
What is that called? What is that wire called?
I don't know.
Didn't we look at this one time?
I think we did. I think it's
Yeah, I know there's a name for it. I just can't think of
a
what it's called.
coil, or I think, yeah.
Yeah.
Let's see. Aneurysm. I don't know.
Yeah, I can't remember either. That's okay. I might look it up here. Okay, Tom says, actually, we might have mentioned this. In a previous webinar, you said that stress can cause a heart attack without any blockages. How does that work?
That works by the artery. We just talked about this a few minutes ago. The artery closing down and squeezing and preventing the blood from flowing through it. That's Takotsubo syndrome. And that's the dying of a broken heart. And it can cause death. It's not completely benign just because your autonomic nervous system is closing off your arteries. Just because you're doing it yourself doesn't mean it's not risky. It's risky, and people do die from it.
Okay. Let's see. Rosario said, I'm sorry. Rosaria said, I'm sorry, I cannot find my notes. What can you do to help a starving heart?
Okay, so starving heart. So I'm going to make some assumptions here of what I think a starving heart is versus what other people might say a starving heart. So if you have a halfway closed artery and there's just a little bit of blood flowing to it, then that part of the heart might be starving, right? It's not getting enough blood flow. So what needs to happen is you need to open it up and allow the blood flow to go in there. And so the ironic thing is that the only way we know of to do that, actually, there's several ways to do that. You can do it quickly by fasting. So if you're in a hurry and your heart is starving and you want to get that flowing again and get it functioning, best thing to do is fast. The other thing to do, there's been a lot of research on this from Dean Ornish in the 1970s and 80s, who actually did research and proved that you could reverse the heart disease and the atherosclerotic plaques in the arteries can be shrunk down, and you can have better blood flow to your heart by putting them on a program of diet. And this is like similar to the diet that we talk about in the Healthy Heart Solution Kit. A really high fiber diet, low fat. That's one. And then exercise and nutrient supplements, which would include the four we just mentioned, and then a stress reduction program. Okay, so you can get the book, Dean Ornish, Reversing Heart Disease. You can get that. That's an old book. It's been around for decades, and it works. So it's interesting, though. There was a recent study done in India. Same kind of thing. They took people who already had heart disease, and they said, okay, we're going to put you on this program, similar kind of program. And so it was Indian food, right? But also vegan. So a lot of fiber and a diet with exercise and supplements, and then 40 minutes a day of meditation. So this is in India, right? So they went and looked at them at the end of the study, and they had regressed their heart disease. Their heart arteries had opened up between 20 and 50% more. Okay, so wow. And if you would if you went to your cardiologist and said, oh yeah, I have a 70% block in my heart, what do I do to make it 50%? Your cardiologist, she would say, there's nothing you can do. That would never happen. It never happens. So if it does happen, is that a miracle? Is that the hand of God? I don't know, because in these Indian people, it worked. 20 to 50% regression. So in other words, they had better blood flow. So they did what's called a regression analysis. They did an analysis on the study, and they looked at, okay, which of these was the most important, or which really affected the heart, the regression, the improvement. What gave the most benefit of improvement? Was it the diet, this special vegan, high fiber, low fat diet? Nah, no, hardly anything from that. Oh, exercise. What about exercise? Yeah, nothing fun. Oh, supplements. Had to be supplements. No, it wasn't that. Um, 40 minutes of meditation a day is the one thing that could could account for all of the regression, all of the improvement that these people had. It wasn't diet. It's not about your diet. So people have asked us in the Healthy Heart Solution Kit, why do you guys talk about stress so much? Dude, stress is the most important part, and all of the research shows that. Even like Dean Ornish in the 1980s, when he wrote his book, he's had all these things. He said, you can't leave out the stress reduction part. That's important. But he didn't know how important because he couldn't separate out the effect, what the different thing, how the different things affected the improvement in the heart blood flow.
And if you want to get some good webinars where we talk some more about this, the stress, the impact of stress on things, boy, we've talked a lot about it in the past few webinars, I feel like. So if you go to YouTube, make sure you check those out because there's a lot of really good information. Okay, Christine says, sometimes I take famotidine or famotidine, sip on water and try to relax. Sometimes helps, sometimes doesn't.
So famotidine is an antihistamine. And it's a H2 blocker, so it stops your stomach from making extra acid. And so you can take famotidine. I don't know what that has to do with the stress, but it does decrease the stomach acid. So if that's an issue, then yeah, and if acid reflux is causing your chest pain, then that might be an issue. But consider this, that instead of famotidine and that, consider the dietary part of it. And that is, go to bed at night with an empty stomach. So don't eat until don't eat after 6 o'clock, anything. Have something light maybe if you have 6 o'clock, but like don't eat anything heavy after 3 o'clock. So eat breakfast and lunch, and you could even skip dinner, which is actually a really good way to live, is to eat breakfast and lunch and skip dinner. And then so then you wouldn't need the famotidine anymore because you wouldn't get acid reflux if you have an empty stomach. You stop making acid, and that's probably an easier way to do it.
Okay. Anonymous said, I'm not on any glucose lowering medication, but I have a glucose monitor which will notify me if my sugar is going high, 180 to 250. To lower my glucose level quickly, I take one or a combination of the following: 1 to 2 fiber capsules, avocado chunks, turmeric tea, magnesium capsule. Are these okay, as they seem to lower my glucose level within 30 to 60 minutes?
Yeah, that's fine. That's really there's no problem with those. However, if you're getting blood glucose around 200, that's significant. And that means your set point is high. So there's an optimum set point so that you get good glucose passing through membranes. So you have to have proteins that actually grab glucose and bring it into a tissue, meaning your brain, your kidneys, your heart, because glucose doesn't just cross, it doesn't go across membranes at all. You have to have insulin receptors and glucose, insulin-like peptides that bring glucose transport proteins that bring glucose in. And so if your blood sugar is that high all the time, then you're going to have difficulty getting that glucose across the membranes because you make fewer of those glucose transport proteins. So it's kind of important to get your glucose into the 70 to 90 range. It should always be 70 to 90. Okay, right after you eat, it'll temporarily go up to 110 or whatever, but it should come right back down to 70 to 90. And that's normal, and that's where it should be. So if you're getting that high, consider doing phase 1 of the Diabetes Solution Kit. That would be a good idea.
Okay. Anonymous said, a few months ago, I had chest pain when exercising or exerting myself, but it would go away and not stay for long. I had an EKG and an abnormality showed up. I was told to stop exerting myself. Then I was sent to do a stress test and it confirmed my EKG. They just conducted an angiogram and found 3 blockages in my arteries. They are recommending CAPG. Can I do anything or is surgery my only option? They want to move pretty quickly with procedures.
Yeah. Okay. So you have what's called stable angina, which means you have a blockage in your artery that, you're whatever. They'll tell you exactly what it is. You're 70% blocked or 90% blocked or whatever. And if it was only 70, they would usually have a stent put in. So it's probably even more than that. But it's called stable angina because it's not there when you're sitting and resting, or it goes away with rest. And when you're exercising, then it comes back because your heart needs more blood flow, and it's not getting that blood flow because the arteries are blocked. So that's what's going on. So in that kind of a case, there's always the risk of a clot forming and blocking off an artery completely and leaving you then with a heart attack, either fatal or non-fatal, right? So that's why they say, you should take care of this soon, right away. Surgery is not your only option. Surgery does one thing and one thing only. And this is really important to look at the big picture. If you look at all-cause mortality for people with heart disease, those who have the surgery have just as long a life as people who don't have the surgery. So that you're not going to live longer because of the surgery. What it does is it relieves chest pain. That's its purpose. So if you want to do something else, you can. So you can reverse heart disease entirely in the ways that we talked about today: the Dean Ornish program, the Barton Publishing program, the India program. I don't know who did that. But yes, there are ways to relieve that without having to have surgery. Surgery does not prolong your life. What it does is relieves chest pain. So if you're having chest pain, you're a cardiac cripple, you say, I can't function, I can't even walk to the sink and wash my dishes because I get so much chest pain, then you have to look at maybe surgery is an option for that so that you can function. So that's the way to look at it is how functional are you, and how much are you willing to make changes. And I told you about that other guy that completely reversed his severe heart disease of can't even walk across the room kind of heart disease in 30 days with just drinking water only.
Yeah. Okay, Bev said, what causes an ascending aortic aneurysm, and how can one control blood pressure once this occurs?
Okay, ascending aorta is you have the heart's beating, and then the aorta comes out of the heart. It's the biggest artery. It comes out of the heart, the left ventricle, and it's the one that hooks around and then goes down. So when it goes down, it's the descending aorta. When it's going up from the heart, it's the ascending aorta. And that area right there is where it gets the most pressure from the heartbeat. And so if you have a weakness in your collagen or a weakness in the artery there, it can get bigger and bigger and balloon out. And then as it balloons out, it's just like any balloon. If you blow up a balloon with only a little bit of air, you can't pop it. But if you blow it up really tight with a lot of air, then any little thing, even a grass, it touches the grass, pop, it pops easily. That's kind of like the aorta. As it balloons out, it gets thinner and thinner walls, and it gets more likely to pop. Oh yeah, see. So there's surgical repair there, and that's what they're showing here, how it ballooned out, and then they put a Gore-Tex on there to graft to repair it. And that's an option. That's a big surgery. They have to crack your chest. It's a tough surgery to go through. So the question is there anything else you can do? Maybe lowering the blood pressure Once it gets to a certain size, 5, 6, 7 centimeters, that's pretty big. It starts getting dangerous where it's likely to pop. Whereas when it's just like 4 centimeters, just a little bit enlarged, then you have time to do something, like lower your blood pressure. So your question for me was, how do you lower your blood pressure? Well, we made a whole diabetes or a heart disease solution kit. Healthy Heart it is a lot about blood pressure and how to maintain a normal blood pressure. So having good blood flow to all of your organs, especially your brain, is really important. So exercise helps a lot. And also getting your metabolism normal. So if you have diabetes or pre-diabetes or anything like that, get that under control, because that is going to affect your blood pressure too. And then the stress reduction methods, all the things we talked about, how important stress was in this kind of a thing. And then on top of that, there are some things you might do to improve the ability for or to prevent that from ballooning out more, to increase the strength of your collagen. And something called MSM, methylsulfonylmethane, is a sulfur supplement. And you take 500 milligrams 3 times a day with vitamin C. And again, 500 milligrams 3 times a day. And then add in some collagen peptides. It's not common, but sometimes the lack of certain peptides, which are the amino acids, will cause the collagen to be weaker. And so adding in the collagen peptides, making sure you get plenty of that, would be a good way to assure that you're doing the best you can to keep that aorta closed and solid and functional.
Okay. All right. Thank you, Dr. Saunders. We'll see you tomorrow for our next webinar.
Mañana.
And we hope that all of you come back for that as well. Again, register for that at bartonwebinar.com. You can find more information there about our products as well. Use code webinar25 to save 25%. You guys